Thanks for the introduction there. So I'm not Diego Gomez, as you probably have come to appreciate that. I'm filling in for him. Unfortunately, I was unable to attend this conference, so I'm going to try my best to work through his presentation. So over the next few minutes, I'm going to talk about, does the physicochemical approach help to improve some of the acid-base disorders that are found in diarrheic calves? Diego was responsible for creating this presentation, and as such, he had no financial disclosures that he wanted to make at all in this presentation. If we look at historically how acid-base is diagnosed, or metabolic acid-base disturbances are diagnosed, it's mainly through two main methods, or the Henderson-Hasselbalch equation and also using the base access. And there really is it seems to be a lot of controversy surrounding what's the best way to really diagnose some of these acid-base disturbances. And in fact, if you look at the transatlantic debate, which is what Diego has pointed out here, it seems that the Henderson-Hasselbalch equation is used a lot more commonly in North America, where the base access is used more commonly in Europe. If we look at how these particular ones really diagnose acid-base disturbances, there's obviously some pretty significant differences between them. So the Henderson-Hasselbalch equation really looks at the levels of bicarbonate that are found within the calf. And that's how they'll go about diagnosing metabolic acidosis and metabolic alkalosis, just purely based on the levels of bicarbonate. Or if there's high levels of bicarbonate, you expect there to be metabolic alkalosis. Or if there's lower levels of bicarbonate, it's metabolic acidosis. If we look at base access, just really briefly, it looks at the amount of acid or base that's really required to correct the pH of the blood for the calves to 7.4. So basically, when the base access is high, it represents a metabolic acidosis or alkalosis, and when it's low, it represents a metabolic acidosis. The strong iron difference is something that was developed in Canada, I believe, in the 1970s. And it takes a different approach to really diagnosing some of these acid-base disturbances. So basically, it looks at sodium, potassium, and L-lactate as being one of the things to calculate it. It also looks at unmeasured strong anions like D-lactate, and also looks at weak acids, mostly albumin. If you look at some of the human literature on this, there's some interesting stuff that has come out recently, where they went out and they looked at some critically ill patients that were found in the intensive care unit. And what they found is that some critically ill humans that have normal levels of bicarbonate and also normal levels of the base access actually had underlying acid-base disorders that were diagnosed using the strong iron difference or the physicochemical approach. So what we tried to do in the study was really to determine the level of agreement that's available between the traditional methods that we use to diagnose acid-base disturbances, the Henderson-Hasselbalch equation and the base access, and really compare that to the physicochemical approach, or the strong iron difference that I outlined at the beginning, and looking at that in diarrheic calves that have pH and PCO2 values that are within the reference range. And the hypothesis that Diego and his group had were really that diarrheic calves with normal pH, PVCO2, will actually have existing metabolic derangements that can be detected using the physicochemical approach that you would miss using the base access or the Henderson-Hasselbalch equation. How Diego and his group did this study was they had a retrospective study, and what they did was they looked back on all the medical records from calves that were admitted to the Ontario Veterinary College in Canada, and they looked back on cases coming in from 2010 all the way up to 2016. For their inclusion criteria, they looked at calves that were less than 21 days of age. They had to have a duration of diarrhea that was less than 48 hours. And they also had to have measurement of blood gases and basic serum metabolites in the first hour of hospitalization before any fluids were administered to the calves. So what they measured on the blood gas was they looked at the partial venous carbon dioxide, they looked at pH, they looked at the level of bicarb, they looked at the level of base access, which is calculated by the blood gas machine. They also looked at electrolytes, mainly sodium, potassium, chloride, and L-lactate, and they also looked at the plasma proteins. So this slide is just trying to highlight how the three methods really go about diagnosing the acid-base disturbances. So I'll kind of go through it briefly. So we have the Henderson-Hasselbalch equation, and that mainly focuses on bicarbonate. And the reference range for bicarbonate is 20 to 30 millimoles per liter. If the level of bicarb is decreased, that again indicates that we have metabolic acidosis, whereas if it's increased, it's indicative that we have metabolic alkalosis. It also uses the anion gap to calculate the acid-base disturbance in the Henderson-Hasselbalch equation, whereas if we have levels that are greater than 20 millimoles per liter, that's indicative of acidosis. If you look at base access, the reference range is -2 to 6 millimoles per liter. And if it's declined, it's indicative of acidosis. If it's elevated, it's indicative of alkalosis. And again, the anion gap is used in this, where if it's greater than 20 millimoles per liter, it's indicative of acidosis. If we look at the strong ion difference, the formulas can be found at the bottom of the slide over here. Where basically, for strong iron difference, it uses the levels of potassium, sodium, and subtracts those from chloride and L-lactate. And normal reference range for that is 38 to 44 millimoles per liter. If it's declined, it's indicative of acidosis. If it's elevated, it's indicative of alkalosis. They also use unmeasured strong ions, which is mostly going to be D-lactate in the formula that's down below here. -3 millimoles per liter to 3 millimoles per liter, and if it's declined, it's indicative of acidosis. And finally, look at the levels of weak acids, which is mostly albumin. If it's elevated, it's indicative of acidosis. If it's declined, it's indicative of alkalosis. How they analyzed this data was they did a McNamara's chi-squared to see if all the approaches were really similar in how they went about identifying these acid-base disturbances. And they also did a kappa coefficient to look at the level of agreement between the pairs detecting metabolic acid-base disturbances. So these are the 37 calves that we looked at in the study. These are the blood gas parameters and other parameters that were found throughout. And what you'll see as you go down the list is that virtually all of these were in the normal reference range. The level of pH was normal, PCO2, bicarb, and anion gap was all within the normal range. So was base access, strong ion difference, the level of weak acids, and the unmeasured strong ions. And if we look at how each one of the three approaches really diagnosed the metabolic acid-base disturbances, it was kind of interesting result in that the Henderson-Hasselbalch equation found about 30% of these calves had a metabolic acid-base disturbance, so whether that was metabolic alkalosis or acidosis. Base access abnormalities are found in about 25% of the calves. And the strong ion difference actually diagnosed a metabolic acid-base disturbance in 68% of the calves. Okay, so quite a significant level of disparity between the three different groups. So if we look at this particular slide, which highlights the McNamara chi-squared and also the kappa coefficients for each one, where we compared basically one group to the other. And if you look at the first column, which is the Henderson-Hasselbalch equation and the base access, you notice that those are not significantly different from each other in the McNamara's chi-squared. And we look at the kappa coefficient, there was a fair agreement beyond chance between those groups. So potentially those two are telling us very similar things in regards to acid-base disturbances. If we look at Henderson-Hasselbalch compared to the strong iron difference, you can see that there's a significant difference between those two and how they calculated the acid-base disturbances. And if you look at the kappa coefficient, there's really poor agreement beyond chance between the two groups. The same story can be said for the base axis compared to the strong iron difference, where there are significant differences between the two groups. And also in the kappa coefficient, it's poor agreement beyond chance. So in this slide, Diego tried to highlight the 27 calves that were normal or had normal levels of venous pH and also PCO2 and base access. So really by the Henderson-Hasselbalch equations and also by the base access, they would be considered to be totally normal. And if you look at using the physicochemical approach, they found an acid-base disorder in about 63% of the calves. And there's a variety of differences for why these were detected, where we had unmeasured strong ion acidosis in the majority of them, 35%, weak acid acidosis in 24%, alkalosis in 24% as well. And then we had strong ion difference acidosis in 6% of the calves. And then also there's a combination of several of them down below at the bottom of the slide. So what's the conclusion of this study? I think the physicochemical approach can be an improved metric to really diagnose some of these underlying mixed metabolic disorders, especially in diarrheic calves with normal venous pH and PCO2. And then also diarrheic calves with apparently normal acid-base state had some underlying acid-base disturbances that are categorized by the acidifying effects of the low strong ion difference, strong ion gap, and increased total plasma proteins. If we look at how that compares to the critically ill patients in the study that I showed earlier, it's very similar results. In that, 44% of the patients that had totally normal acid-base state based on the base axis and the Henderson-Hasselbalch equation actually had underlying metabolic disturbances. So it's interesting to see that we had very similar results in this study. So in conclusion, when clinicians are building up or working up some of these cases of diarrhea, and in addition to pH, bicarb, and base axis and anion gap, clinicians should consider maybe calculating the quantitative effects of the strong electrolytes, unmeasured anions, and protein on the acid-base balance of diarrheic calves. But really what this study really leads to, and as a researcher you always want to say this at the end, is I think more research needs to be done on this particular question to say, do the underlying acid-base disorders really influence the outcome that you see in diarrheic calves? I think that's really the question that has to be answered at the end of this. So just to wrap up, I'd like to acknowledge the sponsors of the research, the Ontario Veterinary College, the University of Guelph, and also the University of Florida. And I'd like to take any questions at this point. Thanks.